Hi everyone, so welcome back to Monday Reading Live. This is me Vandana PS joining you from Neetu's Academy. Okay, and I'm so sorry for the last day because we had some technical glitches on the day. Okay, so we couldn't conduct the live session. So here I'm with another new material. So we have a new sample question here from part B. So let's do the question first, then we will discuss the answer. So before that, let me know how many of you have joined this live session. Okay. Any new students here? Well, okay. So here comes the question. I'll give you 2 minutes for the question. Please do the question, then we will discuss. All right. So how is the question? Okay. So a lot of messages here. Hi, Jobin, Sharanya, Clarina, Benny, Sobi, Vaishnavi. Good afternoon, guys. How's your weekend? Okay. So how is this question? I'll read the question, then let's discuss which category of question is this. Okay, so what is being described in the section of guidelines? So without even any doubt, you can confirm that this is a guideline. Okay, so this comes from the first category. Those are guidelines. So what are guidelines? Okay, Vaishnavi, it was easy. Okay, happy. Yes, hi, Joshna. Yes, Nelsie, hi, good afternoon. Okay, so what about guidelines? What do you guys know about a guideline? What are guidelines? Hi Varsha, good afternoon dear. Okay, so guidelines, which means a set of rules and regulations that someone has to follow. നമ്മൾ നിർബന്ധമായിട്ടും follow ചെയ്യേണ്ട കാര്യങ്ങളാണ് that we are going to deal in a guideline. Okay, and if it is a guideline, okay, once again, guidelines, which means a set of rules and regulations that we have to follow. And which line is important, or I can say which sentence is important in a guideline. So the first sentence is always important. Okay, I'm not saying that the first sentence will be the answer always, but still you will get a lot of clue maybe from the first sentence. Okay, yeah, so coming back to guidelines, then what are you reading for in a guideline? നമ്മൾ എന്താണ് വായിക്കുന്നത് inside a guideline? So we are reading for the details. Okay, as you can see here, we have a set of principles or rules and regulations here. So we are reading guidelines to understand the details. Clear? Yes. Hi Midun, good afternoon. Okay, Akhil. Yes, good afternoon, Akhil. Okay, yes. So we are reading for the details here. Okay. Then when you read a question, always connect with your options. Okay. So the first option, which means what is being described in the section of guidelines. So the first one, different tactics to use with pregnant women who use drugs or alcohol. So my keywords, and you know that when you read options, it's very important to underline the keywords, right? Okay, so different, then tactics, okay, as well as pregnant women. So these are my keywords from text, option A. And what about option B? So the guidelines which indicate the problems mothers using drugs or alcohol cause their unborn babies. So the problems, then unborn babies. So these are my options. And what about option C? Okay, which the guidelines which indicate why birth control information should be given to women with drug or alcohol use. So birth control, then okay, issues as well as should be. So these are my keywords from option C. Okay, so it is very important, I'm repeating, it's very important to underline certain keywords from the question as well as from the answer options, because those keywords which will help you to identify your answers. Okay. Hi Delna, good afternoon dear. Okay, so now I'm moving to this paragraph. Okay, so in part B it's going to deal with 6 questions in total, and the 6 questions will be like multiple choice questions with 3 answer options. Okay, and what are the chances? So we have 3 different chances. One option for sure it will be the correct answer, and one option will be not mentioned anywhere in the paragraph, as well as the last one or the third option will be what? Contradictory or opposite option. So these are the chances that you have. Okay, then so what about reading the paragraph? Guidelines for the management of substance use during pregnancy, birth and postnatal period. So these are the this is the title. Exposure to drugs and alcohol may have a serious effect on the fetus which means unborn baby, in every early stages of pregnancy, particularly before the first missed period. Okay, so there are some possibilities of serious side effects during pregnancy. Therefore what? All women with problematic drug or alcohol use should be provided with advice on contraception. So contraception, which means birth control. Okay, that's called contraception. So what you should do? So guidelines which will give you some information about that you should do. Okay, something you should do. നമ്മൾ നിർബന്ധമായിട്ടും ചെയ്യേണ്ട കാര്യങ്ങളാണ്, already I've told you. So here it's all about something that we should follow. What? Therefore all women with problematic drug or alcohol use should be provided, നിർബന്ധമായിട്ടും കൊടുക്കണം എന്നാണ് പറയുന്നത്. Okay, so should be provided with advice on contraception. Then long-acting forms of contraception are generally preferred. Example, progesterone, implants or IUDs. This approach will facilitate planned rather than unplanned pregnancies and reduce harm to unborn child. Okay, so if you are providing this kind of instructions to the pregnant women, then definitely not pregnant women, to all the women who are using drugs, definitely it will help them to reduce the side effects for the unborn baby. So that is all about the paragraph, very short paragraph, right? Okay, so let me know in the comment box which is your correct answer, whether it is option A, B or C. What is your answer here? Whether it is option A, B or C. Okay, yes, hi Mary, Suresh, Ganga, Neetu, Delna, okay. Okay, so B, option C is your answer because different tactics not mentioned, so that we can eliminate option B, option A, okay. And option B mentioned it's only early stage of pregnancy. Okay, that means contradictory option, right? Okay, so answer is option C. What about others? Okay, Vaishnavi, hi Maria, good afternoon dear. Yes, Vaishnavi, option C, Ganga, Mary, Anu, Jobin, Jissa, Siji Mariam, Maria Paul, Neetu, okay, Anu, Varsha, okay, very good, very good. Okay, Anu, it's not option D dear, actually answer is option C. Okay, I'll tell you how. Okay, then let's do elimination method here. That is the only method which will help you to find out your answer. Okay, so please follow this particular strategy, that's called elimination method. So what is elimination? See, I've already told you to underline the keywords as well as when you read the question, always connect with your options, right? Okay, then different tactics. So what do you make tactics? Tactics, which means those kind of not thoughts but still ideas, like tantraparamayittula ideas. Okay, that's called tactics. Tactics that we are using. So different tactics to use with pregnant women. Nothing mentioned about any ideas or any tactics here, so that you can eliminate option A. That's contradictory option or opposite option, right? Okay, what about option B? The problems mothers using drugs or alcohol cause their unborn babies. See, this is all about a guideline. So what are guidelines? Already I've told you, guidelines, which means a set of principles which you should follow. Okay, not you, yeah, but still if you are a staff, yeah, the staff should follow. So likewise here, this is not about problems. What are the problems? Guidelines informs a lot of instructions, right? This is not an instruction. Of course, you can eliminate option B, plus this is contradictory option. I'm so sorry, first one is not option, contradictory, it is not mentioned. Yeah, second one, it's contradictory option. It's not about problems. These are all guidelines, set of rules, regulations, instructions. So that's option C. This is all about something they should follow. Why? Birth control information should be given. That should be, which indicates a compulsory element or something that they should follow. Women with drug or alcohol issues. So that's my answer is option C. That is the correct answer, which is exactly mentioned here in the second line. Therefore, all women with problematic drug or alcohol use should be provided with advice on contraception, and that is the paraphrased sentence. Clear? Any doubts? Hi Celine, good afternoon dear. Yes, Jinsi, very good, correct answer. Okay, Joshna. Hi Nimmi Jomi, good afternoon dear. Okay, so any doubts regarding part B? Any doubts regarding part B? Okay, so once again I'm condensing everything. In part B we have 6 questions in total, 1 to 6 set of questions, and the 6 questions will be like multiple choice questions with 3 answer options, and you will have a definitive paragraph there, so that you can read the question, then read the options and read the paragraph, find out your answer, and it's not just a piece of cake, right? Okay, so for that you should read the question, underline the keywords, then it's up to you. Whether you can read the options first or you can read the paragraph, then do the same. Okay, then the only method which we are using here, that's called elimination strategy or elimination method. So elimination, which means deleting or removing any of these options. Okay, so that's all about that. And finally, the most important part is they will not ever give you the direct sentence from the paragraph into the answer option. For that, they will give you the paraphrased sentence here. Paraphrasing, which means the same meaning will be here, but entirely different sentence structure. I hope it's clear. Okay, hi Kavita. Yes. Sangeeta, Selin, good afternoon guys. Okay, so shall we go move to part A? Okay, so I'm just closing part B. So we have a new topic here, which is part A, teratoma. Okay, yes, teratoma. So how was this material? Was it too difficult or very easy or average material? I think it was very easy, right? Yes, how is the material? Teratoma. Okay, so I'll read the text, then we will discuss the answers one by one. Okay, but before that, let me know in the comment box what are your keywords from each of the text. Okay, because it is very important. I just want to know how the way you guys are marking or underlining the keywords, because those keywords which will help you to find out the answers. Okay, so please do comment what are your keywords from each of the text. Okay. Okay, Vaishnavi, it was an easy material. Okay, dear. So let me know what are your keywords from text, dear. Okay. Yes. So please let me know in the comments so that I can correct you. Okay, that was the important part, because if you guys are, commenting your answers here in the comment box, so that I can correct whether it is your answer is correct or not. Hi, Shani. Yes. So I'll read text A. So please, at that time, you guys can type your answers here. I mean the keywords here, so that I can correct you. Okay. So text A, a teratoma is a type of germ cell tumor. A tumor starts in your reproductive cells like eggs and sperm. Most teratomas benign, non-cancerous, but sometimes they can become malignant or cancerous. Then germ cells, the only cells in your body that can turn into many other types of cells. So when a tumor starts in your germ cells, it can turn into many different types of tissue. This means teratomas can contain fragments of any part of the body, or fragments of any body part. Some of the most common structures inside teratoma include teeth, hair, fat, muscle. It is even possible to have one with eyes, at least parts of them, including eyeballs. Then healthcare providers categorize teratomas into two main types, major teratomas as well as immature teratomas. So what are major? So major teratomas are usually non-cancerous or benign tumors. Then major teratomas can occur at any stage, but they are most common during your reproductive years. Okay. And what about immature ones? Immature teratomas are cancerous, which are malignant. They are most common among children. So these are my keywords from text A. So please let me know what are your keywords from text A. So what are the keywords that you guys have marked? Okay. So let me know in the comment box what are your keywords. Okay. Yes, so be shiny. Okay, germ cell, cancer, eggs and sperm, benign, malignant types of cells. See, so be when you underline keywords, I just, encourage, I'm just encouraging everyone, but still, don't please underline, the combination of words. Okay, for example, types of cells, type of cells. These are combination of words. Okay, instead of that, you can mark separate individual words. We separate mark better. Okay, otherwise we will get confused. Okay, so type is another word, cell another word. Okay, so type, cells. So likewise, you can mark separately. Okay, yes. Cells, common structure, major teratoma, immature teratoma, children, age. Okay, dear. Very good. Then shiny. Germ cell tumor, non-cancerous tissue, fragments, teeth, hair, eyeballs, types, major, benign, reproductive. Excellent. Okay. And the Raki, germ cell tumor, malignant, germ cells, teeth, hair, fat, muscle. Also you can mark certain numbers mentioned. I think 1 or something is mentioned here, right? Yeah. See 1. Okay, and 2 main types. Okay, so it's very important, as well the brackets also. Okay. Yes, benign, teratoma, germ cell, malignant, cancerous, benign, non-cancerous, common structure plus numbers. Okay, dear? Yes, Divi, hi, good afternoon. Okay, Sangeeta, germ cell tumor, reproductive, benign, malignant, teeth, hair, fat, muscle, eyes, categorize major, immature, cancerous, non-cancerous. Very good. Okay, akku, germ cell, tumor, benign, malignant types, common structures, very good, excellent. Okay, immature children, okay, nimi, germ cell, tumor, reproductive cell, benign, malignant types, common structures, teeth, hair, fat, muscle, immature children. Okay, Vaishnavi, teratoma, type of germ cell, benign, malignant, tumor structures, teeth, hair, fat, muscle, healthcare provider, very good, healthcare provider is one of the important keyword. Benign tumors, reproductive years, excellent. Immature teratoma, children. Okay, Benny, teeth, hair, fat, eyeballs, children. Okay, excellent. Okay, so this is how you should be marking the keywords from the text. Okay, so now I'm moving to text B. It's all about the symptoms. So if they've mentioned about any title there, of course you can mark all the titles as well as a subtitle. Okay, so here we have a subtitle that is symptoms. So what are the symptoms here? Okay, individuals with the teratoma may remain asymptomatic for a long period of time or long time, and some may never develop any symptoms. Okay, someone may not. When symptoms do occur, however, they vary depending on the location and size of the teratoma. Ovarian teratomas can predispose individuals to an ovarian rupture or torsion, leading to acute pain in the pelvis or abdomen. Testicular teratomas can present with a lump or swelling in the testicles, whereas mediastinal teratomas can affect breathing and cardiac function if they grow very large. Finally, sacrococcygeal, it is sacrococcygeal, it's a very lengthy term, but still the pronunciation is sacrococcygeal. Teratomas can develop even before birth, then resulting in the high demand of blood, and that can potentially lead to fetal heart failure. When sacrococcygeal teratomas develop after birth, so a lot of time showing words mentioned here, they can lead to a progressive lower back pain symptoms caused by obstruction of the genitourinary and gastrointestinal tracts. These symptoms include constipation, abdominal pain, urinary or bowel incontinence. In rare cases, sacrococcygeal tumors can cause muscle weakness in the lower limbs as well as numbness or parathesis. Okay, so that's all about text B. Okay, so what are your keywords from text B? Okay, I think no numbers mentioned, but still a lot of words, different words that indicate time mentioned here. Okay, so what are the words here? What are your important keywords from text B? Let me know. What are your keywords from text B? Okay, sorry, individuals is also one of the keyword. Okay, healthcare providers, individuals, staff, professionals. Okay, okay, so I hope you guys are typing, right? Okay, I'll wait. Okay, I'll read text B, then I'll check your answers here. I mean, your keywords in the comment box. So I'll read text C. It's all about diagnosis, a very small text, right? Okay, diagnosis. Diagnosis of teratomas begins with the thorough clinical history and physical examination. In most cases, small teratomas are discovered incidentally when diagnosing another medical condition. First-line investigations include X-ray, CT scan, MRI or affected area in order to see the extent and characteristics of the growth. An imaging hallmark of teratomas is the presence of fat, which is derivative of the mesoderm. It is mesoderm. Then further laboratory tests may include obtaining levels of serum alpha fetoprotein, which is the tumor marker for immature teratomas. Finally, tumor biopsies may be conducted to determine whether the growth is benign or malignant. So these are my keywords from text B. A very short number of keywords because it's all about a different kind of test, okay, that we can do. Okay, Benny, symptoms, long time, location, ovarian, testicular, finally, very large, after birth. I think one more word is there, before. Okay, somewhere in the paragraph they've mentioned about before something, so that you can mark the word before also. Okay dear, thank you so much for your attempt. Okay, so what about others? So this is all about text C. So now text D. So what is text D is all about? We have a flow chart here. It's all about a pictorial. So on the histopathological findings, so this is all about something result or study. Okay, mixed germ cell tumors or immature teratoma, chemoradiotherapy, and if it is persistent or elevates, you can do for a tumor marker, then radiotherapy. Okay, follow-up MRI, yeah, all this kind of short forms, continue chemotherapy, second look surgery for growing teratoma syndrome or recurrence. Okay, yeah, so these are my keywords from text D. Hi Star, good afternoon dear. Okay, so coming to the first question of this material. Okay, so let me know in the comment box what is your answer for the first one. The unlikely signs of sacrococcygeal tumors. So my keywords, unlikely, then signs, sacrococcygeal. What is your answer? Any idea? So the first one. So what about the first question? Unlikely, signs, sacrococcygeal. Okay, Bindu. Yes. Hi, Roshna. Good afternoon, dear. Okay, Benny. Any other answers? First one. Unlikely signs of sacrococcygeal tumors. So my keywords, unlikely, signs, sacrococcygeal. Okay, so my answer is from B. Okay, so that's from text B. So why text B? Yes, Bindu, Benny, 𝐿𝐵, then Ragi. Excellent, your answer is correct. It's from B. Okay, so what about text B? Text B is all about symptoms, yeah, signs. Okay, see the last lines. In rare cases, sacrococcygeal tumors, those are the keywords. Okay, rare case, which means unlikely. Can cause muscle weakness in the lower limbs as well as numbness or parathesis. Okay, okay, yeah, so that's from B. Yes, Nelsie, it's B. Okay, dear. And what about the second one? How do we detect the malignant or benign nature of teratoma? So my keywords, detect, malignant, benign. Okay, malignant, which means cancerous, yeah, and benign, which means non-cancerous. Okay, how can we detect, how can we identify these type of cancers? What about the second one? Let me know in the comment box what is your answer for the second question. Detection of malignant or benign nature of teratoma. Okay, so my answer is C. Okay, so why C? It's all about identification. That is why my answer is C. Okay, diagnosis, identification, detection. Okay, so my answer is C. It's all about how we are identifying these two different natures, benign, okay, as well as both. Okay, so that's all about in severe cases or in malignant or benign form. The identification is mentioned in text C. Okay, yes, Shiji, Benny, Siji, Mariam, hi Siji, 𝐿𝐵, then Nelsie, Raki, it is from text C. Okay, Shiny, first question is B. Very good, dear. Okay, so the third question, which are the two main types of teratoma? So my keywords, the only two keywords which I'm marking is two and types. Okay, two main types. Where is it mentioned about two main types? Yes. Okay, Kavita, yes, it is from text A. Okay, so the main type, see, already I've marked the keywords here, two main types. Okay, so answer is A. So let me check your answers. Yes, Kavita, Siji, Mariam, Sobi, yes, Raki, Nelsie, Star, 𝐿𝐵, Sankita. Excellent. Okay, answer is text A. Fourth one, what about fourth one? So what about fourth question? The initial management to be taken if histopathologists detect immature teratoma. Okay, so the keywords, initial, management, histopathological. So these are my keywords from text, Fourth question. Okay, so once again, when you underline keywords, don't mark more than 3 keywords. Okay, so these are my 3 keywords from fourth question. Okay, Shiny, yes, it is from text area, third question. What about fourth one? Histopathological. With the help of that single word, actually you will get the answer, right? Okay, see, histopathological finding. So where is it mentioned? It is mentioned in D. Okay, so answer is D. Okay. Okay, Shiny, very good dear. Yes, it is from D. Okay, Raki, very good, correct answer. So fifth one, what are the characteristics of ovarian teratoma? So my keywords, characteristics, then ovarian, yeah, teratoma is the material, right? So, so what about fifth question? Any idea? Let me know what is your answer. Fifth one, characteristics of ovarian teratoma. Yeah. Okay. So answer is B. Okay. So where is it mentioned in text B? Characteristics of this ovarian teratoma. Okay. Text B. Yeah. Second paragraph is all about that. It's one of the symptoms. So ovarian teratomas can predispose individuals to an ovarian rupture or torsion, and the rest of the lines it's all about ovarian teratoma. Okay, so that's B. Okay, Siji, Mariam, Nelsie, Benny, Raki, Shiny, Bindu. Very good. Text B. So jumping to the next. Who are the frequent candidates of immature teratoma? So my keywords, frequent candidates, immature. The word immature is mentioned in, I think, 2 of the text, right? Okay, we have seen that particular word somewhere else, yeah. Rather than text A, it is mentioned somewhere else. Yeah, but still, sixth question. Frequent candidates. So those are the other keywords we have. So frequent candidates of immature teratoma. Answer is A. Okay, so what about frequent candidates? They are most common in children. See? Okay, so that's from text A. All right. Then seventh one, the first line imaging techniques employed to detect growth of teratoma. Okay, so my keywords, first line, then imaging techniques. Okay, so these are my keywords. The first line imaging techniques employed to detect growth of the teratoma. Where is it mentioned about these imaging techniques? Actually, it is mentioned in 2 of the text, I know. But what about this word first line? Employed. I'm not marking employed because my keywords already have marked. Okay. Yeah. So first line imaging techniques. Any idea? Okay, Shiny, Benny, Nelsie. Yes, Ragi, it is, yeah, text A. What about next one? Seventh one. Okay, Sankita, very good, dear. Answer is C. Okay, it's not D, it's text is C because the methods is mentioned. Diagnosis about using a different kind of imaging techniques, X-ray, CT scan, MRI, that's mentioned in C. First line investigation. So those are the keywords. So that's from C. Okay, any doubts regarding 1 to 7 set of questions? Anyone? Yes, hi Laizama, good afternoon dear. Okay, so that's that. So now we are moving to short answer questions. So the first one, the primary management technique to be employed if the histopathological findings assure mixed germ cell tumors. Okay? Without any doubt, I know that my answer is from text D. Why? Because this word is only mentioned in text D. What word? Histopathological finding. Okay? So the primary management technique to employed. So we need to know what is the primary, the first management. Okay? So what is the primary management? That's from text D, I know. Yes, Kavita, Shiny, 7 out of 7. Excellent. Very good, very good. Okay? Yeah. So I think tomorrow I'll give you a tough material. Okay, like Thursday. Okay, Thursday we were dealing with a very tough material. So likewise tomorrow I'll give you a tough material. Okay? Okay, so what about this one? What is the first, the initial, the primary management? It is chemoradiotherapy. Okay, so when you write chemotherapy, it's not chemotherapy, chemoradiotherapy, chemo-radiotherapy. Okay, that should be the answer. So, so 8th one, it's chemoradiotherapy, chemo-radiotherapy. Okay. Okay, yes, Nijisha, hi Nijisha, it is it's not chemotherapy dear, it's chemoradiotherapy, okay? Okay, Shiny, yes, correct. Okay, Nelsie, it's not chemotherapy, it's chemoradiotherapy. Very good, Saji, chemoradiotherapy. Chemo-radiotherapy. Radiotherapy is actually a single word, right? That's one. Yeah, that's see? Okay, chemoradiotherapy. Okay. Then 9th one. Yeah, okay, Shani, I'll do. 9th one, the byproducts of which area might be presented as the fat, the imaging hallmark of teratomas. So my keywords, byproducts, which area? Yeah, these are my keywords. Byproducts, which area? Which area? The imaging hallmark of teratoma. So, byproducts of which area might be presented as the fat. Okay, so I think it's mentioned in text C in the diagnosis area because I've seen a kind of word there. Okay, so I'm reading here, 3rd line, and imaging, see, imaging hallmark, yes, of teratomas is the presence of fat, which is derivative of mesoderm. So answer is, which is that area? That is mesoderm from C. Yes, Asha, it is mesoderm. Shiny, Maria, Nijisha, Vaishnavi, Sangeeta. Yes. Okay, Sobi, mesoderm. Very good, very good. Okay, Siji, Mariam, it's mesoderm. Okay, Nimi, it's mesoderm. Very good. So now the next one. Yes, Anu, Bindu, Nimi, Saji, it's mesoderm. Yes. Okay, and if you guys are writing that M, if it is in capital letter, you should follow the rest of the answers in capital letter. Manchalayo. That is, 9th question answer, mesoderm, if it is that M is in capital letter, M capital lanangil, 8th to 14th. Rest of the question it should be starting with capital letter. Otherwise, it is wrong. All letters are capital. Okay? Not all letters are first letter. Okay, every answer's first letter should be capital if you guys are writing M capital. I hope it is clear. Okay, okay. Yes, Divi, yes, it is mesoderm. 10th one, the chronicity or elevation of which element insists on having additional radiotherapy or the thought to proceed with another regimen. So this is a very quite lengthier question. So my keywords, chronicity and radiotherapy regimen, which means routine. Okay, so what about that one? 10th question. 10th one. Okay, okay. Yes, so that is mentioned in, again, I guess it is from text C. Okay, right? Is it from text C? Yeah, so what is the correct answer here? It is tumor marker. Okay, see, further laboratory tests may include obtaining levels of serum alpha protein, which is a tumor marker for immature teratomas. Finally, tumor biopsies may be conducted to determine whether the growth is benign or malignant. Okay, so where do you get that answer from? Tumor marker? Where is it mentioned? Okay, 10th one. Where is it mentioned? Yes, actually it is mentioned in text C as well as in text D also. Okay, the keywords, exactly the keywords mentioned in text D, as you can see here. Okay, already we have marked certain keywords from text D, so that, see, tumor marker, it is the answer. Persistent elevates, another keywords. Radiotherapy is another keyword. Regimen, another keyword. Okay. So tumor marker is already there in text C, plus the keywords mentioned in text D. So that answer is from not C, it's from D. Okay. So this is the keywords. I mean, persistent, elevates, radiotherapy, and regimen. Okay. So answer is tumor marker. Okay. 11th one. Who is the tumor indicator of immature teratoma? So my keywords: tumor, indicator, immature. What about 11th one? A lot of correct answers. Okay. Yes. Okay, Nijisha, Sangeeta, Benny, Nimmi, Akku, Anu, Thomas, Siji, Mariam, Star, Delita, Saji, Jacob, Sangeeta, okay. Divi, okay. Kavita. Okay, it's tumor marker. What about 11th one? Who is the tumor indicator of immature teratomas? What about 11th one? Who is the tumor indicator of immature teratomas? So my keywords. Okay, so the keywords mentioned in, where is it mentioned? Any idea? So what is the correct answer there? Who is the? Who, which means yeah, are. Indicator of immature teratoma. So answer is yes, it is children. So answer is children from text A. Immature, then indicators, they are common in children. So answer is children. Okay. And 12th one, the non-cancerous type of teratoma is termed as. So what is it? Non-cancerous type. Non-cancerous type. Yeah. So these are my keywords. Non-cancerous type, which means what? That's called benign, as well as cancerous, which means malignant. But the question is asking you regarding type. Okay, so type, we have two types, mature, immature. So which one is showing non-cancerous? See, benign, your answer is correct. Okay, benign, which means non-cancerous, and malignant, which means cancerous. Pakshe, question is clearly asking you about types of teratoma. So what are the types of teratoma? It is mature teratoma and immature teratoma. Shariyale. So idinathe edana non-cancerous or benign. So which one is non-cancerous or benign? That is mature teratomas. Okay. So answer is not benign, it is mature. Okay. Sorry. Yes, Benny, Siji, Star, Vaishnavi, Divi, Bindu, Shiny. So sorry guys, it's not benign, it's mature. Okay. Yes, Nimmi, very good. Yes, Sumi, it's mature. Okay. So now I'm moving to the next one, 13th one. The category of teratoma that affects breathing and cardiac function if it grows into larger size. So my keywords: category, breathing, cardiac function. Okay. So what about the category? What category? What category they are talking about? Okay. So that category, it's from, I think it's from text B. Yes. So what category they are talking about here? Okay. See, in the second paragraph, ovarian teratomas can predispose individuals to an ovarian rupture or torsion leading to an acute pain in the pelvis or abdomen. Testicular teratomas can present with a lumbar swelling in the testicles, whereas mediastinal teratomas can affect breathing. Okay, so that is one of the keyword. Cardiac function. Okay, another one. So answer is which category? It's mediastinal teratoma. So answer is mediastinal from text B. Okay, yes. Correct answers, yes. Okay, Nalsi, Shiny, Sumi, Saji, Shiny, Priya. Okay, mediastinal. And 14th one, the phase of the life in which one could have the most confrontation with mature teratomas. So which phase? Which phase of life? The stage phase, which means the stage of life. So phase of life in which one could have the most confrontation. Okay, so my keywords: phase, most, confrontation. Any idea? What is the answer? 14th one. Which phase? Okay, and yes, I've seen some phase here, one stage of affecting this teratoma. It's mentioned here in text A, I guess, right? So where is it mentioned in text A? Okay, mature teratomas. So see, mature teratomas are usually non-cancerous. Mature teratomas can occur at any age, but they are most common during your reproductive years. So answer is reproductive years. Okay, so that is the correct answer, which is reproductive years. Okay, then, so that's all about that. Then 15 to 20, which are fill in the blanks. Okay, 15th one. Ovarian teratomas can predispose individuals to an ovarian rupture or torsion leading to dash in the pelvis or abdomen. So ovarian teratomas, pelvis, abdomen. So what is the missing word here? I know that it's from text B, okay, which is mentioned in text B, right, or text C? Yeah, it's from text B. So what is this missing word here? It is from the first line, second para. Ovarian teratomas can predispose individuals to an ovarian rupture or torsion leading to acute pain in the pelvis or abdomen. So yeah, those keywords are mentioned here, there directly. So the missing word, which is acute pain. Okay, yes. Okay, Sangeeta, yes, Saji, it's acute pain from text B. Then 16th one. First line investigations include X-ray, CT scan or dash of the affected area in order to see the extent of characteristics of growth. Very easy question. What is another word? It's all about diagnosis, I know. So the missing word, which is MRI. Okay, so that's from text C. MRI. Yeah. SCG, Sangeeta, Benny, yes, Kavita, Akku, Jobina, it's MRI from text C. Then 17th one, we need to continue dash. What we have to continue? If the tumor decreases in size on the follow-up, MRI. Okay, is it from text C or the word is mentioned in text D also? Okay, so we need to continue. We should continue this. We should continue what? Okay, so that's from here. It's MRI. Okay, so continue with on the follow-up MRI, tumor decreases in size. Those are the keywords there in size. And continue, another keyword. Continue with what? Chemotherapy. So answer is chemotherapy. Here the word is single. Okay, chemotherapy, single word. All right. Yes, Jobina, Divi, Ubaid, Vaishnavi, Vipina. Yes, Nimi, Sangeeta, Shiny, Shiny Priya. Yes, it is chemotherapy from text D. And 18th one, as the ultimate step, dash may be conducted or to determine whether the growth is benign or malignant. Okay, as the ultimate step, which means as the final step, what we are doing to determine this. Okay, so determine, which means to identify, that means diagnosis. So what is the last step? Finally, ultimately, tumor biopsies may be conducted to determine whether the growth is benign or malignant. So answer is tumor biopsies. Right? Shariana, tumor biopsies. Okay, so answer is tumor biopsies. And second last one, a teratoma is a type of dash, a tumor that starts in your reproductive cells like eggs and sperm. So I know it's from text A, first line, yes. Okay, germ cell tumor. Yes, Bindu, it's yes. Okay, dear. So what about that one? It is a germ cell tumor. Okay, that is the missing word. And what about the last one, 20? An imaging hallmark of teratomas is the presence of dash which is a derivative of the mesoderm? Again, already we have dealt with this question previously. So that's mentioned in text C. And what about that? It's an imaging hallmark of teratomas is the presence of fats. See, already I've marked it. So fats is the answer. Okay, yes. Okay, Saji, germ cell 19th one. Okay, Divi, shiny. Yes, okay. Okay, Saji, it's tumor biopsy 18th one. So what about the last question? It is fats. Okay, so clear? So anyone with 20 out of 20 for this part? Okay, or not because you guys told me it's benign instead of major teratomas. Yeah. Okay, so anyone with 20 out of 20? Okay, Benny, 18. It's okay. So next time, better luck next time. Okay. Anyone with 20 out of 20? No. Okay. So I'm just winding up. So take care. God bless you all. See you tomorrow.